Nduta. I'm a clinical psychologist, and it's a privilege and an honor to be here in order for me to be able to teach you and create awareness about drug and alcohol abuse. Sawa sawa, kwa hivyo leo nataka niwafundishe, niwasaidie kuelewa what is addiction, what are the risks, especially to family members, and we're going to recognize the signs, and then finally we're going to look at the treatment process. All right? So, let's start. What is addiction? Drug addiction is a disease that affects the person's brain and behavior and can lead to an inability to control the use of legal or illegal drugs. That is what it means to be addicted. All right? So, drug abuse manifests in the way it affects your judgment, your decision making, your behavior, and even your learning and memory. All right? So, we need to be keen about this substance and drug abuse, alcohol abuse. What is the process of addiction? How can you become addicted? Because we say that we use substances, right? We drink and we use substances, legal or illegal. But how do you end up being an addict? All right? So it is characterized by 5 stages. 5 stages. Number 1 is experimental. Experimental, you're trying it out, maybe peer pressure here or there. Maybe curiosity, you try it out, one-time thing, you're done. Social. Social is every engagement you find yourself going to, if it's a wedding, if it's a work function, whatever it is, and they're serving these substances, you're going to partake because everyone else is doing it as well. So you want to fit in. Instrumental. Instrumental, you're using it now in order to cope with challenges. I'm feeling a bit low, let me try it out. I'm feeling bored, let me take something. I'm feeling stressed, let me take something. And then habitual. Habitual becomes a way of life. It is part of your system. It is part of your routine. So you always consume when you have the opportunity to and when you have the means to. And then finally, compulsive. Compulsive is when you have become fully addicted on the deep end, and so you're consuming because you feel or you believe that you cannot function without these substances. So you there in the audience, if you partake in any of these substances, legal or illegal, where are you at? Okay, which stage are you at? And you need to keep an eye out so that you don't end up in the habitual or compulsive stages. Okay, let's continue. What are some of the common drugs of abuse in Kenya? These are the ones that research has shown to be the most common. Alcohol, legal, right? Tobacco, legal. Bang, or marijuana, or cannabis, or weed. This one is quite popular, but illegal. We have Mira, or Mogoka, as it's better known as, heroin, cocaine, and prescription drugs. These are some of the substances that are most commonly used in Kenya. Now, what you need to know is that it is so commonly used that we have sections of it. Older generations are consuming Mogoka, cat, and alcohol. That is the older generations, but the younger generations are more into trendy things, and unfortunately, trendy things in Africa as of recently, and they're using cocaine, heroin, or weed, or better, it's known as weed for the younger generations, but it is bangi. Okay, so you need to keep a keen eye on how these things are moving. Don't assume that because heroin looks like it's expensive, we have children from rich families who have very easy access to it because it's new in the country. All right, what are some of the health risks that we can or that can occur from using drugs and alcohol? All right, some of the health risks include anemia. It's a blood issue. Cancer. Cardiovascular disease, which is a heart issue. Liver cirrhosis. Depression, which is a mental issue. Dementia. Because some of these chemicals, they will affect the way your brain functions, and you find yourself not having cognitive function, which means memory imeharibika, decision-making imeharibika, everything is affected. We have seizures, gout, and high blood pressure. All right, every time you're going to be screened and you know you have been using these substances and one of these things come up, I want you to be intentional about regulating your intake. If you can actually do away with it permanently, please do so. So let's go over what kinds of factors will put you at risk for addiction. Because much as it is very common and popular, I don't think anyone is born into this life wanting to end up as an addict, right? No one is going to decide, I've woken up and I'm feeling like I need to use drugs to be able to function. This is the life I've chosen for myself. I don't think it's intentional. So there are factors that can lead up to that kind of predicament. So they can be developmental, environmental, social, or genetic. And talking about development, all right, in the early childhood experiences, that can affect how you can become at a risk. You can come to be at a risk of being an addict. So if you've grown up with physical challenges, you've grown up with emotional challenges, or you have experienced sexual abuse, I'm seeing babies in the church, sexual abuse, or have been neglected, or you're from a household which has instability and parents are using substances, parents are poor, parents are in jail, in and out of jail, or the parents have mental disorders, this can put you at a risk of becoming or going down this path of addiction or substance dependence. All right? Now, that is early development. Let's talk about teenagers. Now, you see, our precious, precious youth, which are a gift from God, they have a lot of feelings that they're experiencing, a lot of hormonal challenges. And if at all they are exposed to some of these substances, it might affect them severely. It might be a gateway to a problem, a lifelong problem. All right, so make sure you're monitoring your child and understanding what kinds of social circles they have, so that you keep an eye out, they're not getting themselves into situations where these things are accessible to them. Okay? If at all, I usually say it's better for the caregiver or the primary provider to be the one to educate the children about these things, and not so much so their friends or what is being put on the media. All right, so that is initiation of substance use in adolescence. Then we have substance use and mental disorders often co-occur. And if you are here for the mental health awareness, I did mention that some people who suffer from mental disorders or mental challenges will use substances in order for them to cope with their everyday issues. And one of the most common mental disorders is post-traumatic stress disorder. PTSD, we talked about it last time, and this is a depressive disorder. People will use alcohol to run away from their thoughts, from their feelings. So that is a high prevalence of alcohol use. Okay, let's talk about how this alcohol and drug abuse will affect families. All right, it affects child's development. Prenatal consumption, if you're pregnant, if you're expecting, you don't know you're expecting, because sometimes I know women are not aware, and they still continue to consume these substances. Unfortunately, it will affect the development of the baby in the long run, in the postnatal stage. So infants exposed to substances also may experience a range of social, emotional, and behavioral effects as a result of exposure. And then household safety. This is how substance abuse or addiction will affect your household safety. In this manner, parents will neglect a child's needs, and there's no food in the house. They're not watching the children. What are the children doing? They're not present. All right? They're not present, and so children are not receiving the care that they need, which is really just neglect. And sometimes it can be abuse. They might be beaten because dad or mom are high on something or drunk, and they have this explosive behavior. And so children may be exposed to harsh chemicals in case that there are parents who are leaving these substances all over the house. They can access. All right? So if you are a household which has any of these legal substances, ensure that they are absolutely out of reach of children, because they are curious creatures and will manage to access them. All right, we have psychosocial impact. So this is another effect of alcohol and drug abuse on families. So your psychosocial impact. If it's the children who are being raised by parents who are abusers, they will have challenges with their social development in terms of friendships, making friends, talking to people. It is not easy. It's going to be difficult because they have not been raised in a family environment where they're navigating each stage normally. So they will have a challenge with connecting with people. And parenting, parent-child relationships will lack trust. And the children may feel as though they may need to be the parent, resulting in feelings of anxiety and stress. by all means, do not allow the child. Don't imagine that your child is emotionally mature enough to know what you need or to take care of you. At the end of the day, they're children, they don't know any better. And so that can create stress and anxiety and depression in children if they're in situations where they feel that they need to be the adult in the room. They need to take care of mom because she's drunk or dad because he's drunk. Absolutely not. And then finally, intergenerational. So multiple generations of the family may be affected by substance use disorders. In this way, you have to remember that it is not just you. It is not just one person in the family, it affects everyone. It is a web. So even your aunties, your uncles, your cousins, shoshos, they will all be involved in this challenge. And they will all need to be able to be worried and to pitch in and to ensure that you are well taken care of. So that is a big effect. It causes a lot of duress, a lot of stress. So what am I telling you today, brothers and sisters? I'm telling you to seek support if it is something that you have experienced within yourself. All right? Remember the stages, how you become an addict. Remember those stages and ask yourself, if I'm using these substances, where am I at currently? And what do I need to do moving forward? All right? So that is for you to seek support. However, if you are not in that position, but you have loved ones, family, friends, people that you have noticed, because you have to have noticed some of these symptoms I'm going to read for you. All right? If you are in your work environment and the youth, if there's still any youth here in school, and you're noticing that there's problems at school or at work, and you're frequently missing school or work, and there's a sudden disinterest in school activities or work, or a drop in grades and work performance, you need to recognize that symptom, identify if it is related to any use of substances. Physical health issues, of course, they will manifest. And so people, you notice there's lack of energy, lack of motivation. Someone suddenly gains weight or suddenly loses weight, all right? Or they have red eyes. The red eyes is key. It is key. Ensure that this person is not just sleepy or lacking sleep. Just make sure you keep an eye out on that. Neglected appearance, you're noticing that people have, these people have stopped caring about how they dress. They are not even bathing, they smell bad, all right? And grooming or looks. They don't even brush their teeth or wash their faces. Remember, this is a disease of the brain. It is not always a voluntary appearance. All right, changes in behavior, major efforts to bar family members from entering the teenager's room or being secretive about going out with friends, or drastic changes in behavior and relationships with family and friends. That is a key. Notice, you have to be able to navigate. If you have a child who is going through different stages of life, I want you to be intentional about understanding what are they supposed to be navigating at this stage. And if it is out of the norm, if the behavior is different, don't just say, that's how kids are these days. Be intentional, investigate, and ensure that they have not indulged in some of these practices. And then money issues. Okay, money issues, sudden requests for money without a reasonable explanation, or your discovery that money is missing or has been stolen, or items have disappeared from your home, indicating maybe they are being sold to support the drug or alcohol use. Okay, they will be very nice to you. They will be sweet to you. I will do one thing for money. I will do something so monumental. We were being told earlier that someone was saying, run me over or give me 50 shillings. Refuse to move from the front of the vehicle. Okay, so they will do any and everything to have that money. I want you to recognize that that is not normal. Why would someone want to build you a full house for 50 shillings or 10 shillings? That 10 shillings to get them access to drugs. Recognize that that is bizarre. It is not normal. And then see how you can support them. How can you support them? Finally, you can support them by screening them. You've recognized these symptoms. So the next thing is to advise them or support them or escort them to a hospital where they can be, detoxified. It is hospitalization for medical withdrawal management, detoxification, or therapeutic communities that are highly controlled drug-free environments or sober houses. Okay, outpatient medication management and psychotherapy, that is me. I am here to be able to support anyone who is suffering or going through these difficulties at either stage. And I'm also happy to refer you. All right, and rehabs, you can refer them to a rehab, or they can join support groups such as the Alcoholics Anonymous or self-help groups for family members. All right, with that, I have come to the end of my presentation. Bwana asifiwe. Thank you so much.